Hi, myself Dr. Vivek Sasindran, and today we are going to talk about the treatment options of chronic rhinosinusitis. In my earlier video, I did discuss about sinusitis. We spoke about acute and chronic rhinosinusitis. We spoke about how acute rhinosinusitis can be treated medically. Now, when you talk about chronic rhinosinusitis, this is actually a very broad terminology. In fact, you have a lot of subsets of chronic rhinosinusitis, so which is something that we need to understand. Now, for example, we have chronic rhinosinusitis with polyps. We have chronic rhinosinusitis without polyps. Now, chronic rhinosinusitis without polyps can generally be managed medically. And to a certain extent, chronic rhinosinusitis with polyps also can be managed medically. However, there are cases that are refractory to medical management, and these are the subset of patients in whom you would actually consider a surgical option in the form of endoscopic sinus surgery. Now, similarly, we have something called as fungal sinusitis. Now, you could have fungus from the atmosphere, from the environment gaining access to the sinuses, and subsequently it continues to multiply within the sinus. And the patients could present with symptoms of sinusitis. Now, fungal sinusitis generally does not have medical management. So, the treatment involves removing the fungus from the affected sinuses. So, again, these patients are subjected to an endoscopic sinus surgery. You have another variant of fungal sinusitis, which we call as allergic fungal rhinosinusitis. Now, the terminology itself is self-explanatory. So, these are subset of patients who would actually have a background allergic problem, and subsequently on exposure to this particular fungus, the allergic reaction or the body tends to kind of react to this particular fungus. So here if you see, you are seeing two components. So you have allergy as a baseline problem, and subsequently there is fungus growing inside the sinus, which is actually triggering this whole sequence of events. So these patients would require a dual modality of management, that is in surgery to remove the fungus from the affected sinuses, and subsequently you need medical therapy to kind of suppress the allergic response. Now you have other entities like invasive fungal sinusitis. Now, invasive fungal sinusitis is an altogether a different ball game. Now, these are generally seen in immunocompromised patients, and this is something that you would have probably seen spike up during the COVID time. A lot of patients presenting with the so-called black fungus or mucormycosis. Now, here the treatment is very radical. It is not in the lines of treatment of any of the other kind of sinusitis that I had mentioned. So it involves debriding all the areas that are affected by the sinuses, and subsequently the patients also have to be treated with anti-fungal medications. So it's important to understand what kind of sinusitis we are dealing with, and subsequently it is important to tailor the treatment based on the diagnosis. Thank you.